Hi, everyone. I'm Rich Lucy. I am one of the Senior Prevention Program Managers here at the Drug Enforcement Administration in the Community Outreach and Prevention Support section. And welcome to this episode of Prevention Profiles Take 5. We're very excited about this episode for a couple of reasons. One, our guest, who I'll introduce in just a moment. But this is the first now in our series of video podcasts. We've done about 5 seasons of audio podcasts, and now we're going to move into video, and we're really excited about that. And now on to our guest, Jim Lange. And let me tell you a little bit about Jim, and then we'll get into our interview. So Dr. Jim Lange is Executive Director of the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery, an academic center of The Ohio State University. But he lives in San Diego, where he is San Diego State University's coordinator of alcohol and other drug initiatives. His expertise in prevention efforts on college and university campuses is based on over 20 years at SDSU and over 25 years of prolific funded research in the field of alcohol and other drug misuse prevention. He is credited with over 70 peer-reviewed and scholarly publications and over 180 conference and invited guest presentations. Dr. Lange has also led statewide and local coalitions and other major prevention initiatives. He has served in leadership roles within the collegiate prevention field, including as the executive committee co-chair of the network addressing collegiate alcohol and other drug issues, and continues to serve on SAMHSA's Prevention Technology Transfer Center Network Advisory Board. With that, Jim, welcome to the podcast.
Yeah, well, thank you. Happy to be here.
Yeah, and boy, that was a trip down memory lane as I was doing your bio. As I mentioned the network, first of all, that was a ways ago and a great time in our field when we had that national network of colleges and universities involved in alcohol and other drug issues. And you and I have known each other now going on probably about 22, 23 years ago, really when I started my federal career, as I was a monitor of a grant that you had with us from the U.S. Department of Education. So thrilled to have you here. And actually my first question really stems a little bit from that time because your grant with the Department of Ed did focus a bit on impaired driving. And so, I want to mention that and get right into our interview. So you've been a longtime advocate of efforts to prevent impaired driving among college students. And since last summer, you've been working to raise awareness of this issue. So tell our listeners and our viewers why and what they should be concerned about specifically.
Well, yeah, it's a topic that I've been focusing on for a long time, as you mentioned, and even within that grant, yes, the outcome variables were around impaired driving, and what is often overlooked on college campuses is that impaired driving is actually the number one cause of alcohol-related deaths amongst college students and also injuries. And it's a pretty common thing that a campus is addressing consumption, alcohol, they're drinking, binge drinking. They may be addressing cannabis and other drugs, but they're not always connecting it to the behavior that really is one of the most risky elements of the use, and that is impaired driving. And so that's something that that I've been working on, as we said, trying to make sure that it's front and center. Actually, a few years ago, NHTSA, the National Highway Transportation Safety Administration, and SAD had a call to action around collegiate impaired driving. And that document, I think, really helped spur me to assure that our center was directly addressing this the best we could. And that's why we started convening monthly calls with people who could be stakeholders, whether or not they were at the moment or could be helpful in raising awareness. And that was just around when COVID was hitting. And one of the things we also know is that COVID impacted traffic safety in a way that was really disastrous. Some have said that we lost about 15 years of progress in impaired driving prevention from COVID. And so young people, young drivers, college students have, in a sense, grown up within this environment of higher speeds, more dangerous driving behaviors, including quick lane changes and all that.
Mhm.
And it's reflected in deaths on the road. And so we're trying to make sure that impaired driving is in the discussion on college campuses. And actually, Rich, you've taken on some of the that call to action with
Mhm.
some materials now that have been spurred by those calls, and I think that's helpful. I think we've also tried to make sure that in conferences across the nation and national conferences around college student alcohol and drug issues, that at least some of us are talking about impaired driving so that we can continue to develop programs and try to move the needle back to where we were before COVID and then continue that progress.
Mhm. Yeah, and there's a few things to unpack in what you mentioned, and thank you for first of all mentioning SAD and NHTSA. So you've got Students Against Destructive Decisions, and you've got the National Highway Traffic Safety Administration. That call to action that you mentioned that they released, we do have posted on campusdrugprevention.gov as a resource. In addition to our latest fact card in our series of campus-specific fact cards, as you mentioned, the one we did specifically on impaired driving among college students, which really wasn't on our radar until you started to convene this work group that I'm part of, along with about 10 or 12 others from around the country, because the rates are going up, right? I mean, is that what we're basically seeing? Is that especially in the college student population, that the rates of impaired driving, whether it's alcohol or any other drug, are on the rise?
Yeah, and actually, even before COVID, our center, in partnership with RAD, had started a project in Ohio, trying to raise awareness of strategies to avoid impaired driving, and that's one of the things that is important when we're thinking about college student impaired driving. A lot of times they have some strategies to avoid it, but they aren't being prompted at the right time, right place to use them. Things like designated drivers or using rideshare. And so, but again, it's been a bit of a struggle to move this onto campuses across the nation, have campuses develop programs, but the stats really are speaking for themselves. We do need to address this more than ever because it's been both relatively ignored and impacted by the changing driving behaviors from COVID. The stats themselves around collegiate impaired driving are a bit hard to parse out
Mhm.
because most of the data uses age as its proxy. So when you're talking
Mhm.
about 18 to 24-year-olds, we know that a good chunk of them are college students. There are, of course, college students who are outside that range.
Mhm.
But when you're looking at 18 to 24-year-olds, we do know that a lot of them are college students. And there have been efforts to figure out like what proportion were likely college students. That happens every periodically, so we don't have specific data on that. But that's one of the things that we've been talking about with that group is where can we improve our data collection so that we can answer those questions. What is the rate on your particular campus, for instance? And is it moving in a particular direction? Are the programs that you're putting in place effective? Are you seeing the results that you should want to see from the efforts that you're putting in? And so that's all part of the equation is coming up with good metrics and spurring the plans and the implementation to see improvement.
Mhm. And I know firsthand in putting together the fact card, I just mentioned, you talked about the data is difficult to distill, and that was true. One of the other nuances in putting the fact card together, we mention it on the fact card itself, is impaired driving really can't be lumped into, all drugs. I mean, alcohol impairs your driving differently than marijuana does. than cocaine does, and then prescription drugs do. So, we mention that as much as you can on a little two-sided fact card, but we thought it very important to make that delineation for people. I also wanted to pick up on the data piece that you mentioned. I know you have some advice for our viewers, especially those who might be in charge of administering the surveys on their campus when it comes to collecting specific data. So do you want to talk a little bit about what your thoughts are on that?
Yeah, there's definitely some opportunities that some campuses have based on some surveys that are typically deployed. One of them is the National Collegiate Health Assessment that's out of the ACHA, and it does have items that are around impaired driving, and so a campus can find out their rates, right? It's a little bit difficult um, to quickly understand the data the way the questions have been asked, but it's there. And but not every campus uses the NCHA, and even those who do often don't do it annually. For instance, they
Hmm.
may do it every other year, maybe every 3 years, and so it's difficult to understand trends. There was also a change in the that survey recently, and so it makes it hard to do any sort of longitudinal understanding. So what I would encourage campuses to do, and it's something we've been talking about in this working group, is creating a few questions that campuses could maybe add to other surveys they're doing to get a handle on impaired driving. And one of the elements here, as you mentioned, the expansion of what we're talking about, because we used to really just talk about drunk driving,
Hmm.
and now we've been saying impaired driving very saying that, and it's important to say that because we know that a lot of young people have heard the message around alcohol impaired driving, and in fact that's often a major part of their driver education. There'll be a talks or elements around alcohol impaired driving, less so around cannabis impaired driving and other drug. And because some of those impairments are different, and because some of the research is just starting to catch up, there's basic understanding that needs to be done amongst college students. There's a lot of people out there who believe cannabis does not impair their driving and or maybe even improves their driving. But we
Hmm.
know empirically that's wrong, both in terms of simulator uh, research, where we know that those who were given a placebo do better than those who um, were given cannabis, and then they go through a simulator, and also from crash statistics. And so we know it's impairing, but that knowledge is not necessarily part of the understanding that students have and our general population has. And so we need to be starting to get a little more specific around what's impairing about various drugs and how do you avoid um, driving impaired if you were to have used one of these other drugs. For instance, how long does it take to clear if you've used cannabis?
Hmm.
What do you look for in some of the impairing medicines? And so those sort of things we need to really start building a better uh, set of tools for campuses to use to address specific issues around this much now wider topic.
Hmm. So I want to move beyond impaired driving. As I mentioned in your bio, your career in preventing and researching drug use and misuse among college students spans more than 20 years. What are one or two things that stand out the most to you as having changed in prevention during that time?
Well, some of the tools that campuses now can deploy are in compendiums like the College Aims that NIAAA has put out that gives campuses a rubric to pick evidence-based effective programs. Many of those, when I started, weren't yet established as evidence-based effective programs, nor were there handy ways to find them. And so there is a set of things campuses really should be doing because we know they are effective. There's things that we know do not work now that campuses were deploying. They seem like they should work. For instance, it doesn't work very well to have college students receive drug and alcohol information from uniformed police. It tends to push them away a bit, and actually maybe even rehearse things that they don't agree with as they're listening. But there are ways using, for instance, like a motivational interviewing or motivational enhancement approach that professionals or even student peers can work to have students explore more about the topic and ways that they can be more protected. So those types of strategies, while they may have existed and or were really starting to emerge about 20 some odd years ago, they have now been integrated into more campuses, and that strategy and many of the others really should be done on most campuses. So that's I think a really nice thing to have witnessed is our list of things that are effective has grown.
Yeah, and it's interesting you mentioned uniformed police because our friend and colleague Dave Clausen, former campus police officer, talks about how he employed using motivational interviewing, as a campus police officer, and really advocated its adoption at campus police around the country, and it really was starting to take hold where it was not the punishment approach, if you will, which typically comes with law enforcement. That's typically what people think. It was more the idea of the conversation, right? That's what motivational interviewing at its heart is really about, having the conversation. And I know we've heard that with the different initiatives outside of campus drug prevention.gov that we have here at DEA. Operation Engage, for example, which is more of a community level initiative, and it's the agents being engaged with the community level. And yeah, there is some distrust, if you will, initially with law enforcement at the table. It all depends on the community, but over time, and that's the important piece, over time, that trust is established and a real collaborative effort is gained. So I'm glad you brought that up. And yeah, I look back over the last 20, 25 years, which is basically my federal career. And you're right, when we started, nothing really existed. It was piecemeal, and it really was the NIAAA's call to action in 2004, maybe, or 2002, a little hazy there. But that was the first time that we had the 4 tiers of effectiveness, right? I mean, this was the first time that we started to put these strategies in buckets, if you will. And as I like to say in my presentations now, we have 3 decades plus of prevention science behind us. We're no longer at a point in time where we can no longer say we don't know what works, because we really do. It's just a matter of, I guess in some respects, having the will to do it and the resources. But we do know what works, and the resources are out there.
Well, we know it works, but there has been some changes in the environment as well. There's issues that we're addressing that we don't necessarily have playbook for. For instance, the fentanyl poisoning is something unlike anything we've seen before.
Right.
Fentanyl, of course, an opioid, which for college students is not something that is usually sought after. Obviously, there's going to be some who do, but by and large, that's not a drug of choice for college students, the opioids. But because fentanyl is now within other drugs that might be more attractive to students, they are just as much at risk of a poisoning death than than we would have normally thought of as college professionals. For instance, the opioid epidemic, that's been going on for a long time, but it wasn't
Mhm.
hitting college students as severely. But now with the fentanyl poisoning, it is. And so understanding how to be protected in that is something we're, in a sense, kind of making up as we go along. So different states have different rules around Narcan and Narcan distribution, but
Mm.
that's something that's on the minds of college professionals right now that was never before.
Right.
It's here at San Diego State, we have a robust Narcan distribution program, and we have for a number of years. But that's it's still a process of, okay, this worked, let's keep trying something else to keep expanding it. How do we keep this going?
Mhm.
Another thing, of course, over the last 20 years was cannabis access. Uh,
Right.
in many ways, college students have had access to cannabis in one form or another for a long time, but the environment in which cannabis can be used, the social aspect of cannabis use has changed with states legalizing in various forms, and so that's something that um, that we're really still trying to understand how to address, and figuring out where those harms really need to be focused on. And that's why one of the things that I tend to focus on is that impaired driving component, because that's something that is has always been and will always be a major issue around any of the impairing drugs, and cannabis being one of them.
Mhm.
And then another thing that really has taken off over the last maybe 5, 6 years, maybe a touch more, is campuses understanding the need to have an environment that's really supportive for students in recovery. That initiative is on the minds of campus professionals in a way that I don't recall really seeing before. And
Mhm.
I think that's going to continue to grow. We know that the federal government is also supporting goals to have more recovery programs on college campuses, and so that's something that we've at our center have been talking about. Obviously, for a long time, it's in our name, but we're seeing more campuses saying we should be starting to do things for our students in recovery and creating an environment in which they're welcome and supported, not just with programs, but in the environment. So what does the social environment look like when you recognize that there's students in recovery who would like to participate? And that's something that I think is exciting, but is still, we don't have that playbook. We don't have that college aims. This is the program to do. So we're getting there. We have to be creative. We have to be doing the evaluation so we understand how we can be helpful in that.
Well, I'm glad you mentioned the center because that's a perfect segue into my next question. As director of the center, what do you see as one or two of the biggest challenges that colleges and universities and their surrounding communities are facing right now?
Well, I kind of mentioned some of them. I mean, right now, top of mind is fentanyl,
Mhm.
and how to address it, because it's scary. I mean, there's campuses losing students to this, and it isn't necessarily clear how we as partners with the students can make it a safer place. The things we're trying are like Narcan distribution. We do have campuses who have documented instances in which students' lives have been saved through that process, and so that's good. But it's really something that we are still trying to address. The other things that are happening on college campuses also intersect with alcohol and other drugs. So one of the things that a lot of campuses are discussing is student mental health.
Mhm.
Um, and so that as a sort of broad topic, I mean, that's a really broad topic to say, hey, mental health. A
Right.
lot of times what they're talking about is anxiety, perhaps depression, maybe suicidality. Um, and that's some of the bucket. But something that we don't often see is when those discussions are happening on college campuses, are they understanding the intersectionality of alcohol and other drugs within that topic because it's there. Not with every single student who's experiencing a mental health challenge, but it often is there. And so understanding how we can assure that we have created an environment that supports student mental health, and understanding how alcohol and drugs may factor into that is something that I think is still a struggle. I think it's a little compartmentalized in the discussions that are happening on college campuses. And then another thing that's definitely on the minds of college administrators, if not the staff of the campuses, is sometimes it's been called an enrollment cliff that's coming. The demographics of the United States happen to be in a place where there is a rapidly declining number of 18 to 24-year-olds because of all sorts of demographic things that happened 18 to 24 years ago. And so the number of students who are going to be seeking college education is declining, and it's declining dramatically. And that's going to have fiscal consequences. And so where the resources are going to come from on various campuses is something that over the next 5 years, we're going to still really start having more and more of these conversations. But one of the things that sometimes campuses do when they see these shortcomings is they look for other revenue options. And one of the revenue options that campuses may have is the sale of alcohol at their venues, and other ways of expanding the market. And we are seeing that more and more of the stadiums across the nation that have college sports are selling alcohol. For a while they were not. So it's getting a wetter environment, and that's going to be hard to push against in an environment where there's fiscal struggles. And so that's something that's on our radar. We're not necessarily seeing it happening yet, but if you look out maybe 5 to 10 years, I think we're going to have a lot of discussions like that.
So, Jim, I'm glad that you mentioned these. Two issues that you mentioned are top of mind are certainly fentanyl. I mean, that is top of mind right now for the full court press that DEA is focused on right now. Launched with our One Pill Can Kill awareness campaign in the fall of 2021. And we thank you at the Higher Ed Center for helping to amplify that awareness campaign, because you're right, it is an equal opportunity destroyer right now. I mean, it cuts across all communities, all schools, all cities. Nobody is immune to this, and we are losing far too many people. And we often get accused of it being a scare tactic, and I like to push back on people and say, you know what, this is not a scare tactic. These are facts that are scary. The fact that 6 out of 10 pills that are being seized and tested in the labs contain a lethal dose of fentanyl, and that's what's on the streets right now. The fact that it can be accessible by anybody with one of these, the smartphones, I mean, that's the scary part of this. So yeah, absolutely. Fentanyl has really changed the game. I think that's what you said that a little bit earlier, over the last 20 years. But then you also mentioned the mental health issues. And I know that it really stemmed from my time working at CSAP in the Center for Substance Abuse Prevention and our colleagues in the Center for Mental Health Services. When I do presentations and I talk about the data around drug use among college students, I end with a data slide that talks about the mental health of college students. And those data typically come from, you mentioned the survey earlier, the National College Health Assessment. And I bring that up because we know that mental health and substance use are so closely aligned. And so students will talk about they're using alcohol and other drugs because they're feeling anxious or depressed, and yet they'll turn right around and say that they're feeling anxious or depressed because of their alcohol or other drug use. And so that's where these two issues intersect. So, I'm glad that you brought those up because I think that schools are, if not struggling, they're meeting the challenge in some respects. Certainly around fentanyl, we're very grateful for all of the individual colleges and universities who have adopted one pill can kill, and really are getting that message out. You mentioned earlier about students, college students specifically, where they don't typically gravitate toward opioid misuse, if you will. It's not the class of prescription drugs they typically misuse. That would be prescription stimulants. And so if they're looking for something that they think is going to help them get a better grade, which is an absolutely misguided belief, we know that. There's no research to indicate that if you take a Ritalin or an Adderall or some other prescription stimulant non-medically, it will not help you get a better grade. But here's what's happening. If you follow the chain, somebody's got a test coming up and their teammate or their classmate knows about that. And they say, well, you know what? Let me get you a stimulant. You'll stay up longer, you'll cram, you'll study better. And then 4 people later, they're getting a pill, giving it to their roommate or their teammate. They have no idea where that pill came from. And that's the universal message that we're trying to get out to everyone, including the college communities, is to not take any medicine that's not been prescribed to you by a licensed provider and dispensed by a trusted pharmacy. I mean, that's the universal message.
Yeah, and it's a really important message because it is so different than what we think of as drug use, drug misuse, prescription drug misuse, because of the counterfeit element of it. And so, yeah, it really will take a lot of communication around understanding this. And then the somewhat tragic reality is this generation of college students, they now know people who have overdosed. And so they are looking for solutions. They come to us saying, hey, can we have test strips? What can we be do? Can we get Narcan in our living space? Because they know it's there, but we need to figure out how to really just reduce the likelihood that any of this is happening. And what a college can do, what a university or a campus can do, is think about ways of having as many people trained as possible to address a situation where it's likely someone has been poisoned, and then also think about ways if someone is going to use, let's say, cocaine. All right, illegal, shouldn't be doing it, whatever, but they're going to do it. But we know that cocaine is now also sometimes laced with fentanyl,
Right.
And so making sure there's at least someone in the room who doesn't use it, because we're seeing instances of multiple students in the same instant needing attention, and there isn't necessarily someone to give it. And so having a non-using person, I don't know if we'll come up with a good name for that, but there's other sort of harm reduction components that we need to be ready to talk about, so that we can keep everyone alive through these instances as the general population figures out how to get this out of our stream of illicit drugs, because it's hard for people to understand that they're using something that might actually have fentanyl in it. That's where we're at. So where's the training? What do we need to talk to students about to realistically protect them, so that we can see another day with them to make sure that they stay safe. So that's where we're at with this.
Yeah, it really has changed a bit in how we typically do prevention. And I usually talk about primary prevention. And yeah, our first line of messaging is always going to be non-use. If it's a legal substance and you're underage, our first messaging is going to be non-use. If it's an illegal drug, obviously no use. But we know there are people who ignore the law. And it's like you said, it's almost like, we learn from our time in alcohol misuse prevention, it's almost like the designated driver of the time is always have the one person in your party, right, who is not going to be drinking alcohol. It's similar to the what you just mentioned. We would hope that nobody's using, but we know there are people that are, and so there have to be looking at ways to reduce the risk.
Yeah, and that goes along with things like amnesty policies on college campuses so that people will call 911 when they think something's happening as quickly as possible and don't have hesitation about the consequence of calling for help. And those are the tools that we've come up with so far. We haven't necessarily evaluated them, that is protective, but we've got to try stuff to assure that we don't have those sort of deaths on our college campuses, well, across the nation, but for campuses, our domain, we want to make sure that they're as protected as possible.
So my next question takes us into your state of California, and you have a long history of being part of a statewide initiative to prevent drug use among college students. So I know from early in my career, back in my home state of New York, I was obviously led a statewide initiative there. What, from your experience, do you see as the benefits and the challenges of being part of a statewide initiative?
Well, yeah, I do see a lot of value to statewide coalitions. Actually, it reminded me when you were reading my bio about the network, which was kind of like that too. Campuses can sometimes be rather insular. And campus professionals who are doing alcohol and drug work on their campus often are new to the positions. There's a lot of turnover. And so there's a lot of opportunity for campuses to reinvent the wheel. And there's also a lot of opportunity for them to reinvent a square wheel, because a lot of the things that, as we said, 20 years ago, that we found out didn't work, they seemed like they should. And so it's important to keep that institutional memory and to have people understand what the best practices are. And having it at a state level is helpful because there are different environments and different cultures and different things. And so having that level of state by state is helpful. And it also gives people an opportunity to network and understand. So having coalitions that can disseminate best practices, evidence-based measures, for instance, sometimes even resources, if they are funded through the state, can really help assure that all the campuses are doing what they can with the things that will most likely have an effect. And that's something that we recognized at the center, that there were a lot of states that had state coalitions, and occasionally they would talk, the leaders of those coalitions would talk amongst themselves, and that but not very often. So we actually got a grant from the Conrad Hilton Foundation to convene regularly the state coalition leaders. And we've been doing that now for years. And there's great value for those state leaders to understand how they can strengthen their own state's coalition. And so we've seen that happen. We've seen some states begin to have coalitions that didn't have before because they now see the value. And so that's something that our center is actually quite proud of, is that we have been helping assure that state coalitions are doing what they at least try to do best. That is get everyone on board with evidence-based programs, work together on things that need to be worked together on. For instance, some cities have multiple campuses. It would be weird if they were all kind of disjointed in their approach. It would be helpful if the whole city or whole county was working together on things. So those types of things are possible. And then our center sort of, in some ways, is a place where campuses that don't have coalitions and or can benefit from. Our center has some of this as well. So we do trainings around evidence-based programs. We have webinars. We have the U report, for instance, which is a weekly email blast with some research elements and what's going on in the field. And then we also have a national meeting that brings people together. But our center really believes in the idea of keeping communication open, having people know each other and understand where things are going, because it benefits the country. It benefits all college students if every college is doing what it can on these things. And so this is really part of our mission at the center, is to connect people to the information they need and the resources that they need. Same with those state coalitions at a much more local level.
Yeah, absolutely. And I know, coming from a large state, as you are in a large state, does geography, I'm sure just the size of the state creates a challenge in and of itself, but I have to think that now with all the virtual platforms that are available, that's really helped to bridge those geographic divide within a state.
Yeah, absolutely. Actually, that was a topic of conversation a lot when we started bringing the coalition leaders together pre-COVID. Was what do we do on a state like California or Texas, or I mean, there's a lot of big states that have vast areas. And how do you compete? A lot of land, and so, but we don't have those conversations anymore. Everyone knows how to use Zoom now. You can have virtual meetings and you can do them successfully. We do them with our center, and states are doing it. Now, that doesn't mean that there isn't value to in-person. I think there's great value to in-person meeting people, developing relationships, so that you know who you could call when you have a question, because it's like, oh, I know someone, that sort of thing. That's helpful, and I don't take away from that. But the major barrier, which was geography, for a lot of the campus coalitions, is not a topic of discussion the way it used to be.
Right. Well, as we wrap up the interview, I'm going to ask you the question that I end all of the interviews with of my guests, and that's, what is one piece of advice that you have for our viewers who want to make a difference in preventing drug use among college students?
Yeah, wow, that's a tough question. I guess it kind of depends on the viewer, because I'm thinking this is probably a relatively diverse set of people that might be listening at this moment. One of the things that we know is that having conversations is helpful. And those conversations can take the form that recognizes the true norms of alcohol and drug misuse. So, for instance, a lot of campuses, if there are parents out there listening, the one thing I would recommend they do is talk to their student. We know that from really good research, even though you may feel like, I've sent my kid to college, they're not going to listen to me anymore, it's all about peers. That's not true. Talking to your student before they go off to college and continuing conversations and keeping dialogue open is protective. Making your particular values known to them is protective. Same with students in many ways. So students, if there's students listening, you could be having conversations with your peers that recognize that, in fact, most students do not drink heavily. Most students are not using cannabis. Most students aren't using any illegal drug. And so when you have conversations, you can help correct a misperception that maybe they're the only ones out there who aren't using. That's not the case. And then there's data out there that make it very clear that it is not the majority. Even if those who are drinking a lot or misusing other substances, they may be very visible and they may be easy to spot, in a sense. Right. There's 10 people seeing that one person and saying, wow, there's a lot of people drinking, but none of those 10 actually were. And so it's important for people to understand that, and students should not start conversations with other students with that false norm, with that understanding that in fact the majority of our students are not. And professionals, same, I guess. As you're talking, as you're developing this, you can keep this in mind, keep the norms in mind, and make sure that you're tailoring your messages with an understanding that most students are interested in being in a protective environment. They're interested in not misusing, and so helping them flourish is an important component as well. So I think, yeah, I'll leave it with that. There's a lot of other thoughts, but I'll leave. That's sort of one that might fit many of the audience members.
No, you know what, I think that's a terrific takeaway, is to have a conversation. And you mentioned it, regardless of the stakeholder, parents, have the conversation with your child, whether they're college bound or currently in college. Students, have conversations with your peers and our peers, professionals in other federal agencies, in national organizations, on college campuses. That's how we learn in our field, is talk to each other about what's working, what's not. So I think that that's a fabulous universal takeaway for everyone. So Jim, thank you again so much for being a guest on the podcast. A lot of information that you've shared, everything from impaired driving to resources at the Higher Ed Center, to the benefits of being in a statewide coalition. And again, the takeaway, to have a conversation.
Yeah, happy to do it. A lot of fun. Always good talking with you, Rich.
Thank you very much, Jim. And to our viewers, I want to thank you for tuning in to this episode of Prevention Profiles Take 5. Hope you like the new video podcast format. With that, I wish you to have a great day.